Pneumonia poses a significant threat to sheep health and productivity worldwide. It can lead to economic losses for farmers. Losses stem from reduced growth, decreased milk production, and increased mortality. Understanding pneumonia's causes, symptoms, and prevention is crucial. Early detection and intervention minimize losses. Young lambs and older sheep are particularly vulnerable. Stress, overcrowding, poor ventilation, and inadequate nutrition weaken the immune system. Farmers must monitor flocks for respiratory distress and implement preventive measures. Recognizing symptoms early allows for prompt action and management. A proactive approach is essential for safeguarding animal welfare and economic sustainability. Sheep pneumonia often manifests with a range of symptoms, and recognizing these signs early on is crucial for timely intervention. One of the most noticeable signs is coughing, which may be dry or produce phlegm. Labored breathing, characterized by rapid, shallow breaths, is another common symptom. Nasal discharge, which can be clear, white, or yellow, is often observed in affected animals. Loss of appetite and lethargy are common signs of systemic illness. As the disease progresses, sheep may exhibit fever, indicated by an elevated body temperature. In severe cases, pneumonia can lead to respiratory distress, characterized by open-mouth breathing, bluish discoloration of the gums and tongue, also known as cyanosis, and weakness. It is important to note that these symptoms can also be indicative of other respiratory diseases. Therefore, it is crucial to consult a veterinarian for an accurate diagnosis. Early detection and treatment are essential in improving the prognosis for affected sheep and preventing the spread of the disease within the flock. Pneumonia in sheep can be caused by bacteria, viruses, and parasites. Mannheimia hemolytica and Pasteurella multocida are common bacterial culprits. These bacteria can invade the lungs when the immune system is compromised. Viruses like parainfluenza 3 and respiratory syncytial virus can lead to secondary bacterial pneumonia. Lungworm infestations also cause pneumonia. Lungworms irritate the lungs, leading to inflammation and secondary infections. Non-infectious factors like stress, overcrowding, and poor ventilation also contribute. These factors irritate the respiratory tract, making sheep more susceptible to infections. Understanding pneumonia causes helps in prevention and treatment. Veterinary diagnosis is essential for appropriate treatment. Diagnosing pneumonia in sheep involves a combination of clinical examination, laboratory testing, and differential diagnosis. A veterinarian will typically begin by obtaining a thorough history of the flock's health, including any recent illnesses, vaccinations, and management practices. A physical examination will then be conducted to assess the sheep's respiratory rate, effort, and lung sounds. Laboratory tests play a crucial role in confirming the diagnosis and identifying the causative agent. Blood tests can reveal elevated white blood cell counts indicating an infection. Nasal swabs or tracheal washes can be collected for bacterial culture and sensitivity testing, which helps determine the specific bacteria involved and the most effective antibiotics for treatment. Viral infections can be diagnosed through blood tests or nasal swabs that detect viral DNA or antibodies. Differential diagnosis is essential to rule out other respiratory diseases that may present with similar symptoms. These include lungworm infestation, which can be diagnosed through fecal analysis for parasite eggs, and other bacterial or viral infections. By combining clinical findings with laboratory results, veterinarians can make an accurate diagnosis and develop a targeted treatment plan. Section 5. A case for diagnosis. Unraveling a pneumonia mystery. Consider a hypothetical case study involving a flock of sheep exhibiting respiratory distress. A farmer notices several lambs coughing, with some showing nasal discharge and labored breathing. Concerned, the farmer contacts a veterinarian. Upon arrival, the veterinarian observes that the affected lambs are lethargic and have a fever. Further examination reveals crackling sounds in their lungs, suggestive of pneumonia. To pinpoint the cause, the veterinarian collects blood samples and nasal swabs from the lambs. The blood tests reveal elevated white blood cell counts, confirming an infection. Bacterial culture of the nasal swabs identifies as the culprit. Armed with this information, the veterinarian diagnoses the lambs with mannheimiosis, a form of pneumonia caused by. This case highlights the importance of a systematic approach to diagnosis, combining clinical observation, laboratory testing, and differential diagnosis. By identifying the specific causative agent, the veterinarian can prescribe the most effective treatment and advise the farmer on appropriate preventive measures. Section 6. The importance of veterinary expertise, consultation and treatment planning. Veterinary consultation is paramount in confirming diagnoses, determining appropriate treatment plans, and ensuring the well-being of affected sheep. While this essay provides general information about sheep pneumonia, it should not be considered a substitute for professional veterinary advice. Veterinarians possess the expertise to accurately diagnose the underlying cause of pneumonia, differentiate it from other respiratory diseases, and tailor treatment strategies to the specific needs of the flock. They can recommend appropriate antibiotics, anti-inflammatory drugs, and supportive care measures based on the severity of the infection, the age and health status of the sheep, and the potential for drug resistance. Furthermore, veterinarians play a crucial role in educating farmers about preventive measures, such as vaccination protocols, proper ventilation practices, and good herd management techniques to minimize the risk of future outbreaks. Regular veterinary checkups and proactive health management are essential for maintaining the health and productivity of sheep flocks. Farmers are strongly advised to establish a strong working relationship with a veterinarian experienced in sheep medicine to ensure the best possible outcomes for their animals. Section 7. Combating the infection treatment strategies for sheep pneumonia. Treatment for sheep pneumonia aims to eliminate the causative agent, reduce inflammation, and provide supportive care to aid recovery. Antibiotics are the mainstay of treatment for bacterial pneumonia. The specific antibiotic prescribed will depend on the bacteria identified through laboratory testing. Commonly used antibiotics for sheep pneumonia include penicillin, tetracyclines, and macrolides. Anti-inflammatory drugs, such as non-steroidal anti-inflammatory drugs, may be prescribed to reduce inflammation in the lungs and alleviate fever. Supportive care measures play a crucial role in aiding recovery. These may include providing fresh water, offering palatable and nutritious feed to encourage appetite, and ensuring adequate ventilation to improve air quality. In severe cases, oxygen therapy may be necessary to support breathing. It is essential to administer medications as prescribed by the veterinarian and to complete the full course of treatment, even if the sheep show signs of improvement before the medication is finished. Failure to do so may lead to incomplete eradication of the infection and increase the risk of antibiotic resistance. Section 8. Prevention is key safeguarding your flock from pneumonia. Preventing pneumonia is always preferable to treating it. Implementing effective preventive measures can significantly reduce the risk of pneumonia outbreaks and protect the health of the flock. Vaccination plays a crucial role in preventing pneumonia caused by specific pathogens. Vaccines are available for common bacterial and viral causes of pneumonia in sheep, such as Mannheimia hemolytica, shipping fever, Pasteurella multocida, pasteurellosis, and parainfluenza 3 virus. Proper ventilation is essential in reducing the buildup of harmful gases, such as ammonia, and minimizing the spread of respiratory pathogens. Overcrowding should be avoided as it creates a stressful environment and increases the concentration of pathogens in the air. Good herd management practices such as providing adequate nutrition, clean water, and dry bedding are crucial in maintaining the overall health and immune function of the sheep. Minimizing stress during transportation, handling, and other management procedures can also help reduce the susceptibility to pneumonia. By implementing these preventive measures, farmers can create a healthier environment for their sheep and significantly reduce the risk of pneumonia outbreaks. Farmers should also consider attending workshops and training sessions to stay updated on the latest health management practices. Utilizing online resources and consulting with veterinarians can provide valuable information and support. Keeping detailed records of vaccinations, treatments, and health observations can help in early detection and management of potential issues. Ensuring the quality of feed and regularly checking for contaminants can prevent nutritional deficiencies and support overall health. Lastly, farmers should protect themselves by using appropriate protective gear when handling sick animals to prevent zoonotic diseases. Section 9. Resources for South African farmers, products and veterinary guidance. South African farmers have access to a range of products and resources for treating and preventing pneumonia in sheep. Several veterinary pharmaceutical companies offer antibiotics, anti-inflammatory drugs, and vaccines specifically formulated for sheep. These products are available through licensed veterinarians and agricultural supply stores. It is crucial to consult with a local veterinarian to determine the most appropriate products and treatment protocols for specific circumstances. The South African Veterinary Association can provide a list of qualified veterinarians specializing in sheep medicine. Additionally, agricultural extension officers and government veterinary services can offer valuable guidance on pneumonia prevention and control strategies. By utilizing these resources and working closely with veterinary professionals, South African farmers can effectively manage pneumonia in their flocks and protect the health and productivity of their animals.